Protecting patient privacy. Social media and HIPAA. Technology is part of everyday nursing practice, but it also increases the risk of patient privacy violations. This presentation looks at how social media and technology can lead to HIPAA breaches, what nurses should and should not do, and how these situations can be prevented. For example, a nurse posted a photo with a patient and included details about the patient's condition. Even without using the patient's name, the individual could still be identified based on context. Situations like this are considered HIPAA violations and have resulted in nurses being terminated from their positions. Protected health information, or PHI, includes any information that can identify a patient and relates to their care. This can include names, dates of birth, diagnoses, and even photos or videos. In some cases, posts that seem anonymous can still identify a patient when enough details are shared, especially in smaller communities or unique cases. HIPAA is a federal law that protects patient information. The privacy rule focuses on how information is used and shared, while the security rule protects electronic health data. Privacy refers to the patient's right to control their information. Security involves safeguards like passwords and encryption, and confidentiality is the nurse's responsibility to keep patient information private. For example, discussing a patient in a public space is a confidentiality breach, while leaving a chart open on a computer is a security issue. Technology creates additional risks in healthcare settings. Personal devices, social media platforms, and unsecured networks can expose patient information. For example, photos taken on smartphones may contain hidden data such as location and time stamps, which can reveal where care occurred. Social media best practices include avoiding any patient-related posts. Nurses should not share photos, discuss patient cases, or respond to patients online, as these actions can still lead to patient identification. Even when information has been identified, it does not guarantee privacy, as details such as timing, location, or unique clinical situations can still allow a patient to be recognized. Instead, patient communication should only occur through secure, approved systems within the healthcare organization. If a breach occurs, it is important to act immediately. Nurses should report the incident to their supervisor or compliance department and follow the organization's reporting protocols. Prompt reporting helps reduce further exposure and allows the organization to respond appropriately. Violations can lead to serious consequences. Nurses may face termination, disciplinary action from the Board of Nursing, and possible legal consequences. Healthcare organizations may impose sanctions such as suspension or termination of employees and are required to report breaches. In addition, organizations can face significant financial penalties when patient information is exposed. Protecting patient information requires interdisciplinary collaboration. IT professionals help secure systems, nurse leaders enforce policies, educators provide training, and compliance teams monitor for violations. Organizations that use team-based approaches and continuous monitoring are more effective at reducing breaches. Evidence-based strategies to prevent breaches include ongoing staff education, clear social media policies, secure technology systems, and regular monitoring of compliance. Research shows that combining staff training with strong organizational policies helps reduce the risk of confidentiality, privacy, and security violations. At the end of the day, protecting patient privacy comes down to professional judgment. If there is any chance a patient could be identified, the safest decision is not to share the information.